If you're thinking of undergoing injectable filler treatments, you know that they can be quite dangerous. So in this video, I'm going to show you what is the safest way to get injectable fillers. My name is Dr. Anthony Youn, and I'm known as America's holistic plastic surgeon. I help health-conscious men and women over 30 look and feel their best by teaching them a holistic approach to health and beauty. And today, I'm going to go over with you what 5 things that you need to know and you need to make sure occur if you're going to undergo injectable filler treatments. Injectable fillers are the number 2 most common cosmetic treatment in the United States after just Botox. But did you know that there are certain complications that are associated with injectable fillers? Injectable fillers can lead to complications like blindness, like horrible scarring, and even loss of parts of your face. So they are very, very serious treatments that must be taken that way. So I'm going to go over with you my 5 suggestions, 5 tips and rules that you need to make sure you know about if you're going to undergo these treatments. The only injectable fillers that I use in my office are made with hyaluronic acid, and they're typically Restylane and Juvederm products. Now this is really, really important because hyaluronic acid fillers can be dissolved away. And if you develop a complication, there's a good chance that that can be treated. On the flip side, there are fillers that are not made of hyaluronic acid, that are permanent or that can last many, many years. You might think that that's a good idea for you. Hey, you get less injections. But the problem is if a filler is accidentally injected into a blood vessel, that's when you can go blind. You can, if that blood vessel is clogged, then any part of the body that blood vessel supplies could actually die. And that's what happens when people get horrible scarring from fillers. People have lost parts of their nose, parts of their upper lip. So definitely stick with a hyaluronic acid filler because it can be hopefully reversed if this thing happens to you. The only caveat to that is we also use Sculptra in my office. Now I believe Sculptra can be injected very safely. Now the reason why I think Sculptra is safe as well is because it's very dilute. And unlike fillers that are made of calcium hydroxyapatite or any of these other types of more permanent substances, Sculptra also is a very, very fine substance, which I'm not as worried about with clogging blood vessels. Well, it's not enough just to undergo injections of a hyaluronic acid filler like Restylane or Juvederm. In addition, you want to make sure your doctor has hyaluronidase available. Hyaluronidase is the substance that melts away the hyaluronic acid filler. So if that doctor is injecting you with Restylane and Juvederm, but they don't have hyaluronidase available, and it might take them a few days to get it, well, that's not a good thing. You want to make sure that they have it on site just in case you need it. If you're thinking of getting injectable fillers in the forehead or in this area that we call the glabella, be very, very careful. This could be a danger zone, and if you have filler inappropriately injected into that area, people have actually gone blind from it. So be very careful. Botox is a much better alternative if you don't like the wrinkles in your forehead or your glabella. Well, I've said it before that plastic surgery is the wild west of medicine. And there are good plastic surgeons and dermatologists injecting patients and their nurses and their PAs who do it safely. But there are also a lot of doctors and non-doctors out there injecting patients who are woefully trained at these procedures and don't know the anatomy. So make sure that if you're going to undergo injections of filler, that it's at the office of a real board-certified plastic surgeon or dermatologist. Well, if you've been watching this video, you know that the main thing that we worry about with injectable fillers is intravascular injection, is accidentally injecting that filler into a blood vessel. That's what can cause these horrific complications. Well, one safety mechanism that we can use is a cannula. A cannula is a long, blunt needle that is actually made to prevent its injection into a blood vessel. Now, it's not 100% effective, unfortunately. There are some situations where patients have had intravascular injection with a cannula, but we do know that it helps to lower the risk of that happening. So if your doctor can, I ask them if they can use a cannula for your injectable fillers because it's only going to be safer for you. So if you've enjoyed this video, I ask you to subscribe and check out these other videos for more great information.